Good afternoon, Dr. Mulenga.
Good afternoon.
Welcome to another edition of Doctor's File. How are you doing today?
Doing very fine, indeed.
Last time when we were discussing premature ejaculation, you had a lot of interesting things to say. Today we're moving on to another sexual dysfunction by the name of, please remind me.
Erectile dysfunction.
Erectile dysfunction. I kind of feel we're being biased against men, but anyway, that's just me. That's just me. Talking about erectile dysfunction, just jumping right into it. What is erectile dysfunction?
Erectile dysfunction simply means it's a situation where a man totally cannot get an erection, okay? But not only that, it's also failure to maintain an erection. So it's not just failure to get an erection or to maintain one.
So is it something we should only be worried about when we get older?
No. I said the statistics are scary after 40, but even in young people you get erectile dysfunction. We shall talk about why it should happen like that later.
Because last time when we were talking about premature ejaculation, you kept mentioning about how premature ejaculation was mainly mental, but I'm led to believe this is more now a physical problem, isn't it?
Erectile dysfunction.
Yeah.
Well, in older people, you might get conditions like diabetes, non-insulin dependent diabetes, what they call type 2,
okay,
where you don't use insulin, right?
Yeah.
So it can cause erectile dysfunction, hypertension, diseases of the vascular system, where the blood passes, right? When the vessels constrict. Mm-hmm. Because of fat disposition as you grow older, they reduce in size, so the circulation of blood is reduced, and blood shortage circulation in the penis can lead to erectile dysfunction. These are the physical causes, right? Sometimes it could be drugs like Adomate, Adomate for high blood pressure.
Or maybe it might be easier, just thinking, if we can go through just briefly how an erection comes about, so that we can get to understand all these things which interrupt it.
Right. Let me say something strange here, which many people don't know. Sex actually happens in the head. Sex is in the head.
Really?
Some people think sex is between the legs, okay? But it's not. It's actually in the head. So for you to get an erection, the mind has to settle on certain factors. You have to be, so to say, imaginative. You have to think about certain images for you to get an erection. So it starts from the mind.
In fact, that's a point before you continue that I want to touch on. There is in certain societies there is an argument that, for example, pornography. Or addiction to pornography is one of the factors that leads to erectile dysfunction. Is there any credence to that?
No, not really. Not really, because erectile dysfunction is failure to erect, right? Or failure to maintain an erection. So pornography cannot lead to erectile dysfunction. Okay? Because pornography simply means images of nakedness and all that and all that.
Yeah, but
in fact,
when you are exposed to it a lot,
when you are exposed to the real thing, then it doesn't work.
Yeah.
Not really, no. I think what you can say, maybe when you are talking about masturbation, pornography may lead to more episodes of masturbation.
So masturbation can be a cause.
Enhanced by pornography.
Okay.
Yeah, but not erectile dysfunction.
But can masturbation itself lead to erectile dysfunction?
No.
Okay, then I'll let you continue on your line of thought. Yeah.
So where were we? We were on the causes, right?
Yeah.
I talked about the physical causes. That's it's diabetes, high blood pressure, atherosclerosis, that is fat tissue in the vascular system, use of drugs like Adomate, antihypertensives, antidepressants. Those are all drugs that can lead to erectile dysfunction. But 80% of cases of erectile dysfunction, you are going to find out mind related.
80%.
Yes, 80% is all caused by the mind.
So when we're talking about the mind, these are other arguments we've heard in different fora where people say that, for example, cheating partners tend to have more erectile dysfunction. Is that true? Is because you're stressed about the cheating and things like that? Is that what you're talking about when you're talking about erectile dysfunction?
No. I'm talking about issues. For example, you borrow money from somebody, right? And or the bank, and you are unable to pay. You're under pressure. So you see, the fact that you are stressed about money issues, relationship issues, quarrels between partners, and ending quarrels and all that, the issue of stress is enhanced. So, when the mind, as I said, sex is in the mind. If thoughts take over the mind, they are busy messing you up in the mind, then erection just goes. So because you are trying stress.
Yeah.
Stress is a big factor.
But where does anxiety come in?
Stress, anxiety, worry, they are all in one basket. Anything that occupies the mind is dangerous for sex.
Overly excited?
Overly excited. Don't get overly excited. It's a bad one, eh? It's a bad one.
Well, I'm glad you've said all that because it was bringing me to this, because now we had this debate on premature ejaculation, but now we're on erectile dysfunction. Surely, when we're talking about erectile dysfunction, the herbal remedies out there do work.
No, they don't.
Surely they do.
No, they don't. I'll tell you about the herbal remedies. The problem with herbal remedies is that they have multiple action on the body. So what you think is helping you to have an erection may be affecting your kidneys or your liver. And therefore, it is folly to use unstudied medicines to enhance your sexual performance.
No, but
we don't encourage anyone to take herbal medications to enhance their sexual activity. They don't work. Why? Because they are unstudied. They have got multiple effect on the body, and it's very difficult to isolate one action and say, no, if I take this, then I'm going to have an improvement in my sexual performance, improvement in erection. It's a very, very risky affair.
Okay, maybe we backtrack a bit. So what would you say people should do, those who are suffering from erectile dysfunction?
As I said, 80% is psychological, right? So that means find out what is stressing you, right? Is it loss of employment, loss of a partner? Is it problems in relationships? Work on that one.
But then what role do drugs play?
Now, the only drug that we found working is Viagra. And Viagra is not for young people, but for, age-related. I didn't even mention about the effects of age.
Yeah, what are the effects of age?
Dysfunction. With advancing age, there is increased ability not to have an erection. At least the episodes from one erection to another erection are lengthened. So age is a factor. So Viagra here can help a lot because it enhances blood circulation in the penis. This is a medicine that has been proven to work. But I'm warning my people out there that this drug should not be played with. It has killed many people who take it when they have got heart problems. So you need to be assessed by a doctor before you can take such kind of.
So at what point does medical intervention become necessary?
One of the causes of erectile dysfunction could be, for example, shortage of or reduced quantity of testosterone, the male hormone. Okay, so if we do a blood test and we find a young man of 30 years has got reduced hormonal levels of testosterone, we give you injection of testosterone or hormonal treatment, and you'll be fine.
Fantastic. Okay, just a reminder to people who are listening in on this forum. If they have any further questions, how can they reach you?
We are first of all, we are on Facebook on Doctor's File. We can be found there. And as you are watching on this this YouTube, you find that we shall put a link there where you can subscribe to us. And also, we are encouraging you to have a look at some of the books that I have written, like ABC of Your Health, on Amazon.com.
Oh, fantastic.
You just type in Teddy Andrew Mulenga books on Amazon. You find these kind of books, ABC of Your Health. Whatever I'm talking about is in this book. Okay? Fantastic. If you want more details. You find other books. I've written several. That is Brooms. That's my autobiography. If you want to go to Livingstone, welcome to Livingstone. You find it on Amazon. And the Skeptic book, most controversial book in Zambia, you find it on Amazon.
This is really fantastic. Right. Doctor, it has been lovely having you on this forum. If there are any follow-up questions, I'm sure people can actually go into the comment section and ask you questions. We look forward to doing this again.
Thank you.
All right, then.